Hello, everyone, and welcome to another episode of Arthritis at Home. I'm Kelly Lenvoy, VP of Communications and Public Affairs at ACE, and today I'm joined by a former colleague, Maya Joshi, who was ACE's program coordinator before she went back to finish her studies at the University of British Columbia. But while she was with us, she led a project, a national survey on virtual care in Canada. And we're going to talk about that survey, but in particular, we're going to talk about the presentation that Maya is presenting author, the American College of Rheumatology annual meeting. Maya, welcome to the show.
Thank you. Thanks for having me.
Now, before we get into the actual abstract, and we'll ask you what an abstract is, tell us just a little bit about this annual meeting that we were invited to present our survey results to the American College of Rheumatology's annual meeting.
Yeah, for sure. So the American College of Rheumatology, or ACR for short, is a medical society that serves over 7,000 rheumatology professionals around the world, but is based within the US. So ACE presented our research at the American College of Rheumatology's annual meeting called ACR Convergence. It's one of the largest annual meetings in the field of rheumatology. There are lots of activities that are part of the meeting, including community hubs and study groups, different spaces for networking and educational activities. But the biggest piece of the conference is research presentations. So this year, research was presented from, I think, over 320 clinicians, researchers, health experts, and patients. So we were super fortunate to have our research included in that.
It's I mean, you're probably being modest in terms of who you presented before today, but it's actually, I think it's the largest gathering of rheumatology experts in the world every year. So really high profile. And I'm so glad that you're able to lead the team on the presentation today. I should say that you as presenting author, there were some other people involved in this project.
Oh, yes.
And I'd like to make sure that we mention them as well. One of them being our president, Cheryl Cohen, Anita Chan, who's our programs manager here at ACE. I think my name got on it as well. I'm not sure how that happened. And then we had a couple of analysts from Arthritis Research Canada, Eric Serre and Adriana Lima, who kind of crunched our data for us, who are the really smart people who were able to do that. And then you were able to, from that data interpretation analysis, you're able to create this abstract and a poster. And for people who aren't familiar with these conferences and how they share research findings like ours, what exactly is an abstract and what is the poster session? How do those work?
Yeah, good question. So an abstract is sort of a high-level overview of a whole research project. So it's a small, shortened summary, and it includes the key elements of the project. So things like the purpose for why this research was done, the methodologies used. So in other words, how the research was conducted. Was it a survey, a clinical trial, interviews, etc.? And then key findings, and then also why these findings are important or what the key takeaways are, what sort of conclusions can be drawn. So an abstract poster presentation is where all of these pieces of the project are presented in a visual format on a big poster. And the presenting author, who was me in this case, sort of walks attendees at the conference through the poster and then answers any questions they have. So usually, of course, these conferences up until the COVID-19 pandemic were happening in person. So there's a part of the conference, usually there's different sessions each day where there's a big poster hall and there's tons of folks standing in front of their posters and attendees get to walk around and talk to the presenters, ask them questions. Often there's a glass of wine in hand for all of those attending the poster sessions. So this year was a little different because it was virtual. Attendees could virtually click through different posters to learn about them. We did a pre-recorded narration of the poster beforehand. So at attendees' leisure, they can go look at a poster and hear the narration. But during the actual poster presentation day, with the poster presenters like myself are virtually standing by their poster to answer any questions live. So it was a super exciting thing to do.
Yeah, so when the ACR is held live with people attending, it's upwards of 15 to 20,000 people that attend. So that's a lot of sets of eyeballs who potentially could be looking at this poster. Before you tell us the experience today presenting, maybe just for the people who haven't seen the results of this national survey, maybe you can quickly give us a summary similar to the one you gave today, just to tell people sort of that, or identify for people the key takeaways from the survey.
Yeah, definitely. So I'm just going to pull up the image of the poster here. So to begin with, in the background section, we just identify what virtual care is, which is the delivery of healthcare services and information by electronic methods. And it's, of course, become increasingly common since the start of the pandemic. But little is known about arthritis patients' views and preferences on VC. So then going on to methods, we just sort of write a bit about how we did our project. So really briefly, there was 23 questions. It was an online survey. It was disseminated via patient community networks and social media. And respondents were people who had a physician-diagnosed form of arthritis. And then our data were analyzed thanks to the wonderful work of Eric and Adriana, using different tests of significance. And then we tested for different associations and for the statistical significance of our findings. So just on the bottom left-hand corner, you'll see a table that breaks down some of our key demographic data of our respondents. So who our respondents were. You can see here that the majority of our respondents were female, that most respondents had rheumatoid arthritis, followed by osteoarthritis and then lupus, although there were many different disease areas that were represented just in smaller numbers in the survey. And about half of our respondents were living with disease for less than 10 years, and 66% were living in a large urban center. One really important message here within our demographics is that only 5.1% of our respondents identified as Black, Indigenous, or a person of color. So this shows that this group of people was really underrepresented in our findings and potentially suggests that they are overall underrepresented within patient community networks. So now just going to the left, there's all these different, going to the right, all these different colorful boxes, which are our key findings through different areas. So in the red boxes, we have VC use pre and during COVID-19. So what was most significant was that 59% of respondents were already accessing some form of VC pre-pandemic, but this increased to 88% during the pandemic. So overall, a 50% increase. And then there were some challenges accessing virtual care. So on the whole, in the green boxes, it shows that 85% of our participants were satisfied using virtual care, sharing their health concerns and getting advice that way. However, there were challenges, particularly for BIPOC respondents who were over 3 times more likely to report difficulties accessing VC. And BIPOC, or Black, Indigenous, people of color, were also less likely to be very satisfied with their VC experiences. We asked our participants what they wanted in the future after the pandemic was over, and 66% want both in-person and virtual care options for the future. So there's one comment here that you'll see on the left, on the right hand side of the poster, which is just a open-ended comment that a participant left that I think is quite powerful. It says, I would really like a mix of care in person for more urgent things and when I want my doctor to see a swollen joint or something. And then virtual for stuff I need that doesn't really warrant a visit, like prescription refills, blood test requisition, etc. As a patient myself, this comment definitely resonates with me, and it looks like that's what a lot of our participants were saying to us as well.
What are we doing with the results?
So with the results of these, this is something that you might be able to speak to more, Kelly, but I know that ACE has been using this information to advocate for greater virtual care access. To governments and to health systems. You can expand on that if you want.
Well, yeah, I mean, you're questioning the questioner now, but that's okay, because I think people should know that we are acting on the results and the findings and meeting. I think we've met with almost, I guess, 6 provincial governments now to share these findings. And in all 6 cases, in New Brunswick, Ontario, Quebec, Manitoba, Saskatchewan, and British Columbia, they are all in different stages of increasing and furthering the integration of virtual care into their healthcare systems. And we're just making sure that arthritis insights and perspectives of patients are being included as part of that process. What kind of response did you get?
Yeah, so the whole experience was really exciting. There was lots of great questions, quite fun, definitely challenging as well. People were asking questions about the research that, I had never thought of myself. For example, we had actually a colleague of ours at Arthritis Research Canada who asked a really important question about if our data had yielded any information about patients' experiences, specifically using virtual care with physios or occupational therapists. So yeah, that, wasn't something that we had discussed as a research team, but thankfully, because, we have this really great data and I have access to that data, I could go into it on my computer and pull out certain pieces of information on that topic. So questions like this just sort of reminded me of how much meaningful information can come from a survey on patient preferences. Like there's still probably so many different layers of information that we haven't yet looked at. So it's quite exciting to think about what's left to be explored or studied. Another point was, it was cool. We had a few other attendees who were relating our work back to other studies presented at the conference, which they were providing us an opportunity to fill some of the gaps in our research or things that we weren't able to address in ours by pulling on the data of other studies. And that's really cool because it sort of helps create a fuller picture of virtual care through combining information from different studies. And, hopefully we are able to also fill some of the gaps for other researchers who are studying something similar but didn't have the same sort of approach as we did or weren't looking at the same things. So yeah, that was all very cool.
And I must say, in the meetings that we've had with provincial governments, that focus on health inequities is something that they're very aware of. Over the last 2 years, there have been these fault lines exposed during the pandemic, that there were different patient populations, different segments of society who had real challenges receiving the healthcare that they needed and that they deserve during the pandemic. And certainly I think that was something that was revealed in our survey. And I should remind people too, if they're interested, they can visit our website, because we've actually conducted 3 national surveys this year, and we're about to conduct our 4th and final one in the month of November. But we have also looked at arthritis medication reimbursement and surveyed patients across Canada on that, as well as self-advocacy or self-care issues. And another way that ACE uses this information that we get is it really informs and motivates us for the work that we're going to be doing next year in 2022. And a lot of the work that we're going to be doing is going to be based on what people told us in these survey findings. So I think a reminder to our audience is that when we do conduct these surveys, they are only as successful as the amount of people that we can get to participate, and we really value people's participation. So if they do see a notice of a survey that's upcoming, we really encourage them to participate, and for them to know that their effort is actually benefiting not just ACE and ACE members and subscribers, but arthritis patients across Canada when we share the findings and talk to governments who are responsible for delivering care for those people.
Definitely. Yeah. When you answer, one of those surveys, you can be confident that ACE is really taking those action steps after conducting those surveys to find out what the patient community is saying, and then how ACE as a national organization can really take action on those things.
Well, it was a great experience working on these surveys with you, Maya, and that it's related to some of the academic work that you're finishing at UBC this year. We wish you all the best and good luck in your future endeavors.
Thank you, Kelly. It was a great opportunity, and I'm forever grateful for ACE and all of the really great research team members for this project. And I was happy to be able to present it on behalf of that whole team.
Thank you, Maya. And thank you to the audience for tuning in to another episode of Arthritis at Home. We hope to see you again next week. Have a great day.